Welcome to the Preparation for Adulthood Vulnerable Adults Team presentation. We are a brand new service to Birmingham, whose aim is to help young people and younger adults transition into adulthood by supporting them achieving their goals and aspirations. We are matrix managed, meaning we sit across both adult social care and Birmingham Children's Trust. Our aim is to develop strong, lasting relationships within both directorates. We are also strongly linked to other partners across Birmingham, including Education and Skills, Birmingham Children's Partnership, Community Safety Partnership, and CCG. As a service, we aim to put young people at the centre of all we do. A true person-centred service will only make decisions that benefit and are agreed by the young person or younger adults. We will use several different approaches that put the young person and their family or support network in the centre. We will also ensure that with the right access to information and other services, we can really improve their quality of life and support them to make positive choices into adulthood. This is a crucial time for us to pilot a whole system way of working. We have 2 years to prove our concept and its efficacy. Subject to us making a positive impact, a further 3 years funding is available. Our overall aim is that by intervening earlier and having a person-centered approach, the transition for young people and younger adults will improve. Our service seeks to engage, motivate, and inspire individuals aged 14 to 30. It is their choice to participate and receive support, so consent is paramount. Looking ahead, costs should reduce as there will be less need for expensive statutory interventions throughout adult life. It is important to know that we are not replacing any statutory services, we are working in addition to them. Evaluation of impact is vital, and we are working to make sure we learn from young people and families, as well as from each other and partners, to help shape future investment into this substantial field of work. This shows where we sit in governance. We report directly to the Life Course Board, whose approach is to increase the effectiveness of interventions throughout a person's life. This also shows that our services is accountable to other boards within Birmingham. We want to encourage the co-produced way of working and be able to call upon experience and knowledge from other teams and directorates across Birmingham. The PFA is divided into 3 separate work streams. The Integrated Transitions team have been working actively since September the 1st and have seen some positive outcomes with young people they support. The Transition Hub is a commissioned service to support young people with multiple risk factors who are homeless or at risk of homelessness. It aimed to be up and running by the first quarter of 2021. The Vulnerable Adults team, you may ask yourself, what is the difference between the Integrated Transition team and the Vulnerable Adult team? The answer would be very little. In terms of the approach, the values, the practice model, and the outcomes, the teams work in the same way. The only difference is the cohorts of young people that the Vulnerable Adults team can support. Within the team, we have 2 approved mental health practitioners that will provide extensive support and guidance to our family support workers, as well as supporting other organisations across Birmingham. They will also be able to carry out mental health act assessments with young people within our service. Also, our mental health coordinator will ensure each young person is connected to the right support based on their action plan, which of course will be jointly agreed with them. Our family support workers will work closely with each young person to support them closely and work through their action plans, delivering a range of interventions and connecting them to their local communities. We are using several effective methods such as community circles of support, family group conferencing, and many others. The restorative justice worker will be within the team to support young people to understand the impact of making wrong choices and better understanding decision making. Whilst the coaching and resilience worker will offer dedicated support to improve confidence and self-esteem. Our data analyst and business support roles will also be critical in making sure we run an efficient service, learn about what is working, and be able to recognize any areas we need to address. Our focus in the vulnerable adults team is to reduce the risk of harm to our young people and their local community. Young people who have experienced trauma or adverse childhood experiences include those experiencing violence, abuse, or neglect, those witnessing violence in the home or community, those having a family member attempt suicide, those with an environment that undermines a young person's sense of safety, stability, and relationships, those growing up in a household where there are issues around substance misuse, mental health, and separation, those that have a family member in custody. Equally, we will work with young people who are vulnerable because of extrafamilial harm, where they are, for example, being exploited outside of the family home, online, and/or in the community. As the slide highlights, we will work with young people in custody and on community orders, and those at risk of offending. Young people perhaps known to police who are seeking support, not to criminalize, but to offer an intervention. We also recognize that while many young people may be guilty of committing a crime, very often they are also the victims. So it's important to highlight this.
This slide captures our 4 outcomes for the vulnerable adults team: health, employment, housing, and friendships, relationships, and community. It is widely acknowledged that to support young people to become more resilient, make those positive lifestyle choices, and reduce risk to themselves and others, that health and well-being, suitable and sustainable accommodation, employment and welfare, and a strong support network will have a significant impact. Health. We want to support young people who struggle with managing their emotional health and well-being, their mental and physical disabilities. We recognise there is a huge demand in Birmingham for mental health well-being support, and we also know that mental health is a factor that leads to risky behaviour and the likelihood of offending or re-offending. Our specialist team members will be able to support young people to improve their mental health and well-being. The vulnerable adults team will also work with young people who are either victims of or perpetrators of domestic abuse, as well as those criminally or sexually exploited. Our focus is to support those who have experienced trauma, so health is a key outcome for the vulnerable adults team. We have also found a gap in the support given to young people with autism, and we are undertaking training to understand autism better and how we can provide the best support. Employment. We will help young people search, apply and secure paid or unpaid employment through training and work experience. Building skills and confidence to help someone get secure paid employment has significant benefits for individuals, including increased financial independence, strong social networks, as well as physical and mental health benefits. Housing. We believe housing will be a very big focus of the work undertaken by the vulnerable adults team. We want to support young people who are homeless, at risk of being homeless, or those who are due to transition from a secure estate and need extra support finding accommodation. The hub, which we are commissioning, will be an important part of the service we deliver. We will be able to provide more information about this once the contract has been awarded. Friends, relationships and community. We support young people in building relationships and help to overcome barriers to allow them to be a part of their local community. We know that many young people who are vulnerable to or being criminally and sexually exploited are exploited by people outside of their close family. It is so easy for vulnerable young people to be groomed online, at school and outside the home, and this is especially worrying for those who have endured trauma. The Vulnerable Adults team will work with young people to help them become more aware and understand friendships and relationships better, while proactively seeking positive local community engagement activities for them to access. Within the Vulnerable Adults team, we will have a restorative justice specialist and resilience coach who will be a key part of this particular outcome. An important point to make on this is that preparation for adulthood is about being a connector to the wealth of services and communities already working across the city. Whilst we are building a team of specialists who will be able to work one-to-one with young people, they will also be making sure that they are connected to other specialist services, able to support them in many ways, all of which will improve their transition into adulthood. How will the Vulnerable Adults team work? Our focus is on mental health, homelessness and reducing criminality. This is where we can really see a difference between the integrated transitions team and the Vulnerable Adults team. Even though we will use the same approach and mentality to support young people, we expect the needs of the young person to be very different. If the young person does require support from both teams, we will work closely together, ensuring the needs of the young person are fully met, keeping the young person in the centre of every decision and keeping up that constant communication. We want to raise young people's aspirations and expectations and make them realise they can achieve more and have a better quality of life. We will encourage co-production of action plans between services, and we will work alongside other partners to provide extra support for the young people in their time of need. We are not here to duplicate or replace any statutory services. We offer additional support to our target group who are 14 to 30 across the 4 outcomes, where it is not already being provided. At this time, we are unable to support those with long-term complex medical conditions requiring palliative care, life-limiting conditions, and complex long-term conditions. However, we are in proof of concept stage, and so this may change in the future and as the team grows and as we test and learn from our approach. As the service develops, we will have the ability to flex to meet needs when gaps and barriers are identified. We are unable to support when a plan is already in place that includes the 4 outcomes relating to preparation for adulthood, i.e. health, housing, employment and friendships, relationships and community. We are unable to support where a service already has specialists in post, and we are unable to support a young carer who hasn't had a young carer's assessment completed in the last 12 months. Again, we are not here to replace anyone, so if our 4 outcomes are already being met by a statutory service, we will not take that over. Or if a service is already meeting a need, for example with housing or employment, we will not double up. Or as mentioned, if a young carer hasn't had a carer's assessment in the past 12 months. However, we will be able to signpost to the relevant statutory services that can help. It may be that your service is able to work with a young person in some of the outcome areas, but not all. We can support them to fill those gaps. Given our target group of young people, we anticipate connection requests across many services, including contextual safeguarding team, Empower You Hub, health services, housing, local authority, the probation service and resettlement teams, youth offending service, police and fire services, pupil referral units, voluntary charitable services, and of course, families and young people themselves. We will accept connection requests from any service, organisation or individual who feels a young person needs our support. We are really keen to have further discussions with partners to make sure you have the information you need to be able to make a request for support. The Vulnerable Adults team will go live on the 26th of January 2021. Initially, we will be using our own front door to take connection requests, so please contact the number on the screen. The process will take around 30 minutes to complete, and we are happy to schedule a call back with you if needed. What you can expect is that we will ask questions about the young person's current situation and what support they already receive and what support they need help with. This will enable the approved mental health practitioners to allocate them to the right member of our team. Thank you for listening. The Vulnerable Adults team look forward to working with you.